AM 1220 KHTS, your hometown station. This is the Providence Holy Cross Hour on your hometown station. Go to providence.org/Holy Cross for more information. We're talking with Dr. Keilani. She is the Director of Palliative Care at Providence Holy Cross. And we learned a little bit about what it was. But what made you want to... We talked a little bit about this in the first segment, but what made you want to get into this type of care specifically?
Well, one of the things that we learned at in medical school at UCSD, it's actually kind of a running joke amongst anyone who knows UCSD well. I believe we were the only medical school that had Saturday classes.
Oh.
And it happened
in San Diego?
I know. It really sucked. I mean, I don't think I actually went home much the first year of med school.
Man.
Yeah, so that first year, we did what they call a social history on all of our patients that we encountered. This was alongside, all of the routine science classes and all that stuff. And so we weren't allowed to ask them about their medical problems. We weren't allowed to ask them about their medications. We needed to get to know who they were as people, what they did for work, who they were, in their community and in their families, and what their spiritual background was. So it actually kind of segued into palliative care in a sense, because that's what's important to us as well currently in palliative care. So when I was introduced to palliative care later on in my third and fourth year of medical school, we had mandatory rotations on hospice. And so when we got to really experience that in our first year and then actually see it go through and do the medical care, it just made sense. And then, when I go back to thinking about my uncle, who was my mentor, I mean, he was an amazing family practitioner. He was a very traditional family practice doctor, talked about people's vacations. And I would be waiting in the room next door, waiting for him to give me some care. And I'd be listening in on their vacation plans and talking about what their lives were like. And it's kind of like going back and reinventing what medicine is about. And it's about getting to know people and how to help and improve their quality of life.
So the thing that pops into my mind when dealing with this, obviously you're dealing with people that have pretty serious stuff going on. Does it, and then there are those instances where you're like, okay, we got to switch this to hospice, right?
Yes.
There's those instances. Well, how do you deal with that? How do you deal with, because this is intense stuff, families are stressed out about these types of things. How do you deal with that type of dynamic?
I think one of the things that we pride ourselves on is getting to know our patients and families well enough to really establish a rapport and trust. And if you are not well established and you walk in and go, hey, guess what, your family member is dying and we need to move on with hospice care, I think a lot of people are going to step back from that and not feel very comfortable.
Yeah.
So palliative care really can talk about those types of end-of-life choices and make patients and families feel comfortable about the choices they make. So when we go to talk to our patients or our families, we've already had conversations in advance. So we're already one step ahead, if you will. So when it comes to the time when things are reaching towards end of life, it's not about, what option are we talking about? We're talking about, okay, now it's time for transition. So we really are building that trust, building that rapport, and really getting to support our patients and families well.
I feel like it, just in the little time that I've learned about this type of care, it seems like there are those you get invested, which makes you. I think it makes you a better doctor. Yeah. At least from my perspective, from the perspective of a patient, I feel like if you're invested in the patient, the win that you guys are going to get from if we get through this care together, you're going to feel so good. Obviously, there's going to be some losses,
right?
But it's going to make the wins that much better because you guys can celebrate together, and that seems like something. It maybe talk to me a little bit about that. Getting through this with the family, how much better does that make it for you and for the family.
Oh, absolutely. It makes it just such a worthwhile experience, especially with the wins. The patients that are, move on to having been cured or move on to getting their transplant. It's a beautiful situation. And even with the patients who pass away, it's still a very beautiful transition. And our emphasis is to live life to its fullest, to the best of your capabilities, and have the most meaningful quality experience, and at the same time be comfortable through that end of life experience. So the transition is as beautiful as it can be. We share with our families about the patients. We hug. We embrace our patients and families, and it's a very delicate time, and it's very human. So it's no longer technical and advanced, and it's not hands off. It's very hands on, a very hands on experience.
Yeah, that's. I'm glad you're doing it. That's all I'm saying. I don't know if I can handle something like that.
Everybody.
Yeah, no way.
It's not for everybody.
Yeah, and so there's obviously going to be some changes maybe to palliative care in the future, right? With the healthcare system. So we're going to take a quick break and we'll talk about that. Coming up next, we're talking with Dr. Keilani. She's the director of palliative care at Providence Holy Cross. Learn more at providence.org/Holy Cross. Quick break. More Providence Holy Cross Hour coming up next. AM 1220 KHTS, your hometown station. This is the Providence Holy Cross Hour on AM 1220 KHTS. Go to providence.org/Holy Cross for more information. We're talking with Dr. Keilani. She's the director of palliative care at Providence Holy Cross. We've been talking about the care itself, why you got involved in it, and obviously, the big talk is there's healthcare is a big topic. And so with the healthcare system, how is your job specifically and palliative care in general, how is it? How do you see that? Do you see changes coming?
Yeah. Actually, so because palliative care is relatively new in the medical community, it's becoming more and more accepted. One of the ways that we can always tell if a treatment or a specialty is being better accepted is, what insurance companies are actually paying for it. So we are seeing that more insurance companies are funding palliative care programs and reimbursing for palliative care services. So we are seeing that there is developments in that sense. More of the healthcare systems are delivering this standard of care. So for instance, at Providence, just about every single hospital within the Providence system has a palliative care program. And they have a very extensive program and are really leaders in the nation in regards to delivery of palliative care. So it's a very rewarding time and rewarding experience.
So you're kind of on the ground floor of this, so to speak.
Correct.
How long have you been doing this care?
I've been doing this specifically for the past 5 years.
Okay, so you're on the ground floor in this for sure. How does navigating through that either help or hurt your job? Like having to navigate through the insurances and all that stuff. I know that's a doctor thing, I think.
Yeah.
But how is it? How does it make your job more difficult if some patients aren't covered by it? How does it work?
It's a challenge because within our hospital, the service is wonderful, but once that patient leaves, you don't know what's going to happen to them. So the outpatient palliative care services are still very lacking, and those are still in the works. And in fact, our Providence region here in Southern California has put together a pilot study to really accommodate those patients on an outpatient basis.
Okay.
Not only will they be setting up clinics, hopefully soon, but also doing home visits for patients. So we're looking forward to that within, hopefully by the end of this year.
And so that kind of leads me to my next question. What changes do you see that need to be made or not? Or what's working, what's not working with this type of care?
I think the establishment of more outpatient palliative care is really the most important thing because on the inpatient basis, it's just about standard of care. Any hospital, for instance, I can tell you here in California, about 80% of the hospitals have a palliative care program. Now, program could be on any level. It could be just a nurse operating a palliative care program, or it could be the entire team, nurse, doctor, social worker, chaplain. So for us, we have a full program. But at other hospitals, it may just be, you know, the educational component. But having said that, it's well recognized that palliative care is providing better quality care to our patients. So on an inpatient level, we're seeing that that's actually working well. So we're going to be expecting more outpatient services soon.
Okay, fantastic. And again, we're speaking with Dr. Keilani. She's the Director of Palliative Care at Providence Holy Cross. You can go to providence.org/Holy Cross for more information. And so I want to shift into this a little bit. We talk about, it's kind of taboo to talk about like death and it's uncomfortable too. It's just an uncomfortable thing to talk about with families. So, what do you say to families and listeners that they're about encouraging patients and families to talk about death and these type of hard things to talk about?
I think one of the things that we have to remember is that we're all going to die.
That's true. Yeah.
Right. So we have to acknowledge the fact that we're dying at some point in time, and also embrace that transition. I think we started off with a culture that was, yes, it was very difficult to discuss death. But I find that things are evolving and changing. So if you open up the New York Times or the LA Times on any given week, you may find an article about a patient undergoing an end-of-life experience or a patient undergoing palliative care treatments. So it's becoming more and more accepted. Radio stations such as yourselves are doing programs on palliative care. So I think that it's something that is evolving. It's funny that we're talking about it today on tax day.
Yeah.
Because I think the mantra goes, and I think it was Benjamin Franklin who first said it, that the two guarantees in life are either taxes or death.
Yeah, death and taxes. Yeah.
Yep. And that's it. And so today is the tax day, but tomorrow is National Healthcare Decision Day.
Oh, okay.
April 16th.
April
16th is a huge day for this nation. It is the day to have a conversation with your families about what end-of-life options are important to you, or what does it mean to live your life, and how would you want to be cared for if you were unable to speak for yourself. So these are the things that we are encouraging, and I challenge your listeners to have a conversation tonight about these important topics.
Yeah. And we're going to take a quick break. I want to talk more about this. We're going to take a quick break. Dr. Keilani, she's the Director of Palliative Care at Providence Holy Cross. You can go to providence.org/Holy Cross for more info. Quick break and more with Dr. Keilani after this.